point of Magpas and the volunteer doctors is to try and provide that hospital level resuscitation room at the roadside, and that's what we've tried to do here. And that sort of starts the ball rolling very early, so a lot of what the hospital would expect to do now, we've already done.
I was sold the idea by a GP in the North Riding of Yorkshire, Dr. Ken Easton. The whole idea of GPs turning out to road accidents really was his initiative. He and I, in about 1970, were voted GPs of the Year. I'd set up a radio communication system, actually the first radio paging system in the UK, and he had set up a road accident rescue service covering the North Riding of Yorkshire. And we met at a prize-giving dinner in London. We got £500 each for our initiative, and we got talking. And I was very impressed by his enthusiasm, what he'd done in the North Riding, and he was very impressed by the radio communications because he had realised just how important communications are, first of all, to contact the GP. And in those days we saw more patients on visits in a rural area than we saw in the surgery, and GPs do look after patients over a very wide area of the country. So going 20 miles in all directions without communications, radio communications, you very frequently came back to find that a call had come in and you unknowingly had actually passed that house, and you'd have to retrace your steps. And in accident work it's terribly important because you've got to communicate with the other emergency services, particularly if it's a large incident. So he was impressed by the radio communication system we'd set up in Cambridge with a radio control room manned by nurses, and I was impressed with the concept of GPs turning out to incidents. What sold the idea to me was the analogy that Ken made, that we regard accidents in a different way from diseases. He said, and I think this was a powerful argument, don't talk about accidents and casualties, talk about illness. Let's call it a plague. It's a plague that sweeps across the country every year, and it kills 7,500 people, and probably 250,000 people never fully recover. They are always got some handicap after their illness, and all these, or a lot of these patients are suffering from an illness within our practice patch. We have a duty of care to our own patients, but if you regard this as an illness, then we should have a duty of care to people who contract this illness. In other words, accident victims. And if you look at it like that, we as GPs should be taking an interest in the causes, treatment, recovery of these patients. And I thought that was a different way of looking at it looking at the problem.